Hello and welcome to lesson 4. So this lesson we're going to be talking about the behavioural approach still, but ways to treat phobias. So the first method that we can use to treat phobias is flooding. Flooding involves putting a phobic individual in a situation where they would be forced to face their phobia. This inescapable exposure to the feared object or situation lasts until the fear response disappears. For example, someone who has a fear of enclosed spaces or claustrophobia might be shut in a small room until their initial levels of anxiety reduce. So there are two different ways in which flooding can work. The first way is called in vivo, and this is where the participant is actually exposed to the stimuli. So actually being exposed to spiders or balloons or clowns or whatever their fear is. The second way is in vitro, and this is where it's a virtual reality, so they might be watching a video of their fear or seeing in a performance. Now, in order for flooding to work, the participant must learn relaxation techniques. Techniques will then be applied in one session to their most fearful situation. Sessions usually last 2 to 3 hours, and then as adrenaline decreases, a new relationship can be learned. Therefore, participants start associating relaxation with the fear. However, there are individual differences for flooding, therefore it does not work on everybody. It can be a highly traumatic procedure where patients are obviously made aware of this beforehand. However, some patients still quit the treatment, and therefore this reduces the effectiveness of the therapy for some people. However, counterbalancing that, it is a very quick and fairly successful technique. Coy reported that flooding was more effective at treating phobias than systematic desensitization. This is the second treatment which we'll learn about in a few slides along. However, another study conducted by Krask found that flooding and systematic desensitization were equally as effective in the treatment of phobias. So, systematic desensitization. This was developed by Walt, and it is a therapy based on the principle that one cannot simultaneously be in a state of relaxation and fear. Therefore, it's based on classical conditioning. The first step in the therapy is to teach the phobia sufferer relaxation techniques. The individual is then gradually introduced to the object or to their fear, and hopefully their anxiety begins to decrease. So there are 4 steps to systematic desensitization. The first step is your relaxation techniques, where your patient is taught how to completely relax their muscles. The second step is where the patient has to construct a hierarchy of their fear. So, for example, the first stage of their hierarchy might be just looking at a picture of a spider, and then it will gradually increase in intensity. So then they might have to see a spider but in a box. Then they might have a spider on their shoe, gradually working up to being able to hold a spider as their biggest fear. Patients gradually work through this hierarchy for real, moving from one stage to the next, and then eventually they conquer their fear and they are cured of their phobia. Okay, so evaluating systematic desensitization for your treatment of phobias. So researchers found that systematic desensitization is successful for a range of phobic disorders. For example, McGrath in 1990 reported that about 75% of patients with phobias responded to systematic desensitization. The key to success appears to lie with the actual content with the feared stimulus, so in vivo techniques are more successful than ones just using pictures, i.e. in vitro. Often a number of different exposure techniques are involved, in vivo, in vitro, as well as modelling, where the patient watches someone else who is coping well with the feared stimulus. However, it's not appropriate for all phobias, so Oman suggests that systematic desensitization may not be as effective in treating phobias that have an underlying evolutionary survival component, e.g. fear of the dark or fear of heights, than in treating phobias which have been acquired as a result of personal experience. However, there are strengths of the behavioural therapy, such as dealing with phobias are generally relatively fast and require less effort on the patient's part than other psychotherapies. This lack of thinking means that the technique is also useful for people who lack insight into their motivations or emotions, such as children or patients with learning difficulties. A further strength of systematic desensitization is that it can be self-administered, a method that has proved successful with, for example, social phobia, was conducted by Humphrey. Okay, so that is all you need to know for flooding, systematic desensitization, and the evaluation point. So that is all the treatment you need for the behavioural approach. So we are giving you a night off doing past paper questions, but your activity for tomorrow's lesson is for you to have a phobia. It could be a phobia that you actually have, or just a chosen phobia. And I want you to write a fear hierarchy. So starting with the least scary or fearful factor that could happen and leading up to the most fearful. You must include a minimum of 5 stages, and please bring this with you to your next lesson so that we can discuss it. Thank you for listening. Have a good evening.